Good afternoon, everyone. Welcome to this carer clinic, which is with Dr. Raja, and the topic we're discussing this afternoon is moving home. My name's Sue Hines, and I'm Head of Services at Dementia Carers Count, and I'll be hosting the discussion with Dr. Raja this afternoon. Dr. Raja is an elderly and dementia care specialist who I'm sure many of you have met from our previous carer clinic Facebook Lives. If you haven't, they are available on Facebook and they are available on our YouTube channel as well. So do have a watch because we have talked about various things during these sessions, and I'm sure a lot of them will be very helpful to people. So today we're going to be discussing moving home and planning for the future, which is a huge topic to cover in 30 minutes. And we do various online courses. One of them is a 4-week online course, which is thinking about supporting someone if they're going to move into a care home and also supporting yourself as a carer. But I know, Dr. Raja, you felt it was really important that we do a Facebook Live, a much shorter session with a summary of some of the main topics. Could you just tell us a little bit why you think that's important?
Thanks, Sue, and good afternoon, everyone. I think it's a very important topic to be discussed and to have some idea of how decisions need to be arrived at. And I kind of go back to my time when I was an inpatient consultant in a dementia unit, and we had a gentleman who unfortunately had dementia in his late 40s, early 50s, and as his dementia progressed, it became difficult for him to be managed at home, and he was admitted to the ward, which was one transition already from home to a ward environment. And as I was walking out of the ward one evening, I saw his two very young children, primary school, in their school uniform, just having been brought out of school by this gentleman's wife, mother, and they came to visit him, and it was hard to see their father in a very different environment of a hospital ward, and then it was very obvious at that point that it would be very difficult for him to be looked after at home, and it was also important that his family relationships were maintained and not just subsumed by a care role. So we had to make this difficult decision of the gentleman being placed in a nursing home. And at that point, I truly felt how challenging it must be for the young children, his wife, to be making such an important decision of their loved one being moved to a nursing home environment. So it is a very difficult situation for anyone to come across, and more so because you may have to make decision on behalf of someone who would not perhaps be able to express their preferences in an understandable way. So that's why it's very important to start having this debate, this conversation about what to do and when to do and what kind of things would influence such very important decisions. So that is the starting point for this conversation. So,
Raja, thank you so much for that. It's great that you can share that story with us because there are so many different aspects to it, aren't there? There's the fact that the transition isn't always linear. It's not straight from one place to another. There may be different transitions along the way. So one into hospital, back home, back into hospital, or straight to a care home. Also, sort of the impact on the family. It might be young children, it might be young grandchildren, but also if you're an adult carer, the transition in your role where you've become that carer supporting a person, and then you're thinking of maybe passing on some of that caring responsibility to somebody else, how that feels, and that overwhelming sense that you're making decisions for somebody, and you're responsible for making some decisions for somebody who perhaps doesn't have the capacity to do so anymore. So Lots and lots to think about, and we'll move into
Yeah.
this session now around that. If anybody wants to put any questions or comments in the chat, then please do so, and we'll try to get them during this session. But this session, as we say, does cover an awful lot of topics. We do go into more detail into our 4-week program, but also if we don't get to everything today, I think, Raja, you and I have already discussed, we can do a second Facebook Live on this topic.
Yeah, absolutely. We'll pick up questions that we may not be able to answer today, but also try and expand on some of the broader themes we might be discussing today. Yes.
Yeah, great. Thank you. So going back to your case study before, we've got can be multiple transitions between places. It can be the change in relationships. It can be because the care needs have suddenly changed. It's such a stressful time for family carers and people looking after somebody with dementia. We know conversations and processes are really difficult. Can you give us an idea of some of the factors you see with people are needing to consider when they're thinking about this during such a stressful time?
Yes, as you rightly said, so it's never a linear process. It's never predictable in the sense that although dementia is a common illness of older age group, the experience of dementia is very unique to the individual and the family members, and a lot of personal elements would influence the trajectory of progression of the illness. Therefore, the challenges would be very unique in that particular sense. But generally speaking, though, when the person with dementia starts having problems in terms of personal care, so as in terms of hygiene, looking after themselves, or where they start to struggle or end up having accidents when they are doing domestic activities such as cooking, cleaning, um, that would be important factors to be considered in terms of how the dementia starts to impact on looking after oneself, looking after the household. But equally, though, there will be other presentations of dementia as the illness progresses, especially when people start losing their ability to orient themselves to time or place. So um, they might wake up in the middle of the night believing that it's daytime and they may have to go to work, or they wake up believing that they're in workplace and they need to get on with doing things. Those situations, if they're persistent and difficult to be distracted from, then it can cause a lot of challenge to the family carers and the individual with dementia. But more challenging would be when, unfortunately, dementia progresses to the extent that the person with dementia is struggling to even recognize familiar faces like spouses, the partners, people that they live with. Uh, then it can lead to conflicting situations, and that is something that can be hugely worrying and might make the carer feel very insecure when the person with dementia feels that they're not the person who they are. So I think those would be some of the important things that we need to consider in terms of um, personal care of the household, and broadly speaking, care of the loved ones, because we don't really want them to be stressed or to be affected in any way.
Okay, thank you. And again, as you said when you started there, there isn't one size fits all, is it? It's a unique situation and a unique experience for every person with dementia and also every carer. But I think what you've outlined there is some health, welfare, and safety issues for a person with dementia. And that could occur at any stage. But also, as the disease progresses, the health, safety, and welfare and well-being of the carer who's supporting the person at home as well
Yeah,
becomes really important. So if we think about that, we've got the health, the welfare, the safety of both the person with dementia and the carer. I wonder
yeah.
if you could give us a bit of insight to some of the assessments that are used to try and identify what's the best way forward for somebody or their family.
Yeah. Um, so I think it will be an important point of assessment to be carried out by professionals from different backgrounds. I think that is going to be very important. A part of it would be a medical assessment and a nursing assessment to see how the dementia itself has progressed, what kind of symptoms are presenting at that point of time, and what medications may or may not be able to achieve at that moment. So I think that would be one facet to the assessment as such. Um, Other more important and more essential assessments would involve assessment of functioning ability, and they could be carried out by different professional groups, but essentially it will be an assessment of functioning ability, perhaps carried out by an occupational therapist who would be most trained to do that degree of assessment would be very helpful. Um, and subsequent to that, there will be need for an adult social care assessment because they will be in a better position to understand the kind of care support that might be available locally. So that might involve care agencies, or that might involve respite placements or care homes and nursing homes, but that they would be in a better position to understand the availability of these options. And therefore, it is important for them to carry out an assessment to see what are the needs and how best these needs could be met with what is around, what is available more locally, and also they will be able to assist with financial assessment of the individual with dementia, because it's important to try and make sure that that the cost of care is being assessed, and to support families where they are not able to meet such huge costs. But amongst all of these assessments, what would also be very crucial is for the family carer to have an assessment of themselves. Um, Carer's assessment is very important, because we have discussed this and mentioned this already, that there's a chance of someone who's looking after their loved with dementia to suffer from depression, being burnt out, being stressed, and that would make it difficult for them to be involved in decision making and to come up with uh, with the right decision. So a carer's assessment to support them in that particular context would be equally important.
Great, thank you. So quite a lot of multidisciplinary team assessment and intervention, I guess, to see is there anything to make the current situation more tenable. It might
Yeah,
be pharmacological or non-pharmacological. We've talked in a previous Facebook, haven't we, about the importance of those non-pharmacological
yeah,
approaches to support somebody to live at home. But
yeah.
then also, as you say, you've outlined the importance of adult social care assessment, what's available in the area, what the financial situation is, and lots of other aspects that go into
Mm,
this. And you, at the end there, Raja, you were talking about the carers assessment and how absolutely that's just critical to all of this. And I know
mm,
when we've talked to carers on our courses before now, and people have had individual discussions with us if they've maybe rung our support line, one of the things that is a really useful conversation to have is what wouldn't you be okay doing anymore? What would be your line? Where would you draw your line in the sand that I'm not happy to do that? And for some carers, it's the specific behavioural and psychological impairments
mm.
that they struggle to be able to support someone with at home. And I just wondered if you had any thoughts on the way those behavioural and psychological presentations or symptoms impact on
Yeah,
decision making in your experience.
yeah. Yes. So I think in terms of considering behavioral and psychological presentations of dementia, one of the most challenging aspects of managing the person with dementia and most of the carer, is they'll be facing the brunt of it, is any degree of aggression, be it verbal aggression or physical aggression. Uh, it would be very difficult to be managed, especially if it doesn't really remit with time or medications or even having carers to support or diffuse the situation. I think it becomes very difficult. And one of the important symptoms to be considered is that uh, unfamiliarity might lead to aggression. So if a person with dementia cannot recognize their spouse partner, then it becomes a huge challenge, because come what may, they would never be able to understand who is the person that they are living with. Um, the other important driver for aggression might be if someone has gone to the point of lacking total insight, where they find it difficult to accept that medications are necessary or nutrition is necessary or personal hygiene is necessary. then it might come out as aggressive behavior as well. And those are very different scenarios for a carer to face, because they are in it not just as a carer, but they're not also in a very important role that they hold in from that relationship perspective. And it's always important to for carers to realize that they need to be there in that particular relationship role, uh, not just as a carer. And sometimes it's just that ability to be in as a relative rather than as a carer might be what they need. And for them to get to that, then it's important to consider who could then be providing a caring role, and where could this care be delivered in a safe way. And I've come across situations where those carers who have struggled to make those very important decisions of letting carers come into their house or having their loved ones move to a care home, then suddenly find it very refreshing when they can revert back to what was very important, which is the actual role based on the relationship. And for them to get that opportunity and get back to that idea of being there, discussing all the fond memories that they have, or the conversations that they would enjoy having with their partner, that makes a tremendous difference. And I think that is why it's very important that where they face aggression of any nature, then it's very difficult for them to be in the caring role plus the relationship role. And that, I think, is an important time where this decision has to be discussed and arrived at in a way that makes it easier for everyone involved.
Beautifully put. I've heard when I've spoken with carers, often people will say, "Well, I don't know who I am anymore," and
Mm,
I'm his wife, but I feel that I'm a carer, and I can't fulfill that normal relationship that I had
mm,
before. And like you say, this perhaps is that opportunity to be that person rather than the person who's a carer and trying to deliver the personal care needs, to deliver those helping roles that means that there's some tension between the two
mm,
of them. And just to
mm,
say to listeners, we do some online events. One of them is around memory, and the memory one really looks at where somebody may not be recognizing someone anymore, and therefore there's an unfamiliarity, and that unfamiliarity can cause the person tension. And also one on personal care needs and how to support someone with personal care. And I think those can be useful to family members, but rightly, as you say, sometimes the relationship then gets lost in this transactional process
yeah.
between two people. And so it's of great value to think about, actually, is this something I need to involve in my decision making? But I'm waffling on now. Anyway, I just, before we move on to the next section of this, which is about really the process, perhaps if a decision is made and there's a transition to a care home, I just want to pick up a question in the chat from Joanne. And Joanne has said that her husband was diagnosed last year with dementia, and they've moved home. So they've moved from somewhere that has got steep stairs on levels, and they've gone to a more suitable bungalow, and reluctant to move. I think so they're looking to move from somewhere with steep stairs and to a more suitable bungalow. Do you have any ideas that would help with that move? Because I think if you have, those would be useful for people regardless of where they're moving to, whether it's another house or a
Yeah.
care home.
Yeah, it's so any move comes with very important things to consider. One, the sense of losing somewhere we felt that we belonged to for all our years of life, and then two, the fear of unknown, because we don't really know where or how this is all going to pan out. So a lot of it is trying to be more psychologically understanding of the person whose brain is struggling as such with dementia. And then on top of that, we're adding another burden of trying to make them move to a different place. So one of the important things might be to increase that sense of familiarity by taking them to a place, showing them the layout, showing how it could actually look like. It doesn't have to be that they have to go, but even photographs, videos, all of that would be very, very helpful. If, say, for example, someone did enjoy having a bigger garden, a longer walking path nearby, something like that, making them understand that they will have access to all those kind of things that they love having might be very important. I think it's also very important to get support from mental health services, because then they would be able to have a nurse or a psychologist who might be able to provide that extra bit of psychological support and reassurance that someone with dementia might need. Having said all of this, though, it is a very difficult process. It's a difficult process to move even without dementia, and then to add that becomes more challenging. So I think it would also be important for us as carers, as family members of people with dementia, to understand that the duration that it takes for the brain to accept and adapt will be longer in people with dementia, and therefore it's a question of how resilient we are and how patient we are in going through the process as much as anything else that we could think of. So I think that would be very important as well. What I have also noticed is that, and this happens in when people come into hospitals as well, is that once people do get into that place and when they start having conversations with people around them, or even start having photographs, familiar items in the room where they are, then it makes them less anxious, less worried, and less concerned about their immediate environment. So anything to increase that sense of familiarity would be very, very important, I think.
Thank you, Raja. I think, as you say, for all of us, the transition to somewhere new is a huge challenge and it's a huge burden. And many times carers are carrying that burden of making the decision on behalf of somebody else. But the burden for somebody who has got dementia to understand the situation is hard. And like you said, all those visual cues, taking videos, taking photos so that you can replay and you can go over is really important. And I just want to say again, we do have the 4-week course that goes into this in more detail about moving to a care home. But Joanne, it will also have hints and tips in there around if you're moving, not to a care home, but if you're moving house. And we can also give you some advice and support on that if you want to call our phone line, which will be put in the chat during this session. So that operates Monday to Friday, excluding bank holidays, unfortunately. So it won't be open this Monday. But do give us a ring if you want to talk about it a little bit more. And Diane, I can see your question too as well about trialing care homes. Again, pick up the phone to us, or if you want to send us an email or book onto that next care home course, then we can deal with that and we can support you with that there as well. Because I know I haven't got time to ask Raja to answer all of that question at the moment because we're whizzing through this so you know the 30 minutes is whizzing by so quickly, and I don't want to sort of cut through half a question. So do get in touch with us if you want to. So there are some general challenges just to finish off now if somebody goes into a care home, Raja, and I think it is worth us picking up another Facebook event on this, because I know carers have asked me before, what do I do in those first few weeks? Do I visit? Do I stay away? The care home's giving me some advice, but I'm not quite comfortable with it. So I think we can definitely pick up another Facebook event around this topic. But I just wondered if just some final thoughts, because you mentioned at the very start something around nursing home, residential homes, all the choices that social services will help you with. And just to finish off this session, just to explain really what that difference is, residential, nursing, dual registered, what are we talking about?
So if we look at care homes as a broad spectrum, then we have residential homes and then nursing homes. So residential homes have carers who would look after someone who has moved into that particular kind of accommodation, whereas nursing homes will have trained nursing staff on site along with the carers to try and provide that support. And some of them might expand to include an activities coordinator, their own physiotherapist, occupational therapist. So they might actually branch out into making it more multi-professional, if one could think in that particular way. And within nursing homes as such, you might have nursing homes which are just physical health nursing homes, so they can look after someone who's got long-standing physical health conditions and the consequences of it. Or you could have nursing homes which specialize in dementia care, so they might be what are called as dementia registered nursing homes. If we were to try and think about someone with dementia, although at the start of it, it may be that they may be functioning very well, you generally want to try and minimize transitions as much as possible, because a lot of studies have showed that multiple transitions make things more worse in terms of the dementia progression and also increase the risk of mortality. So if we were to try and think in those terms, then it would be useful to think about long term, and therefore to try and think, if does this care placement have dual registration. So if someone did develop dementia, they will be able to manage it. Equally, does this care home also cater for all stages of dementia? Because certain nursing homes, although they might be dementia nursing homes, they might be more geared towards the early or the moderate stages of dementia. Whereas there might be very specific nursing homes who have staff who are very skilled in managing more challenging behavior, uh, may be able to provide palliative care as the dementia progresses. So it's very important to have a long-term outlook on it and to try and minimize those changes that could make things more difficult, and which would in some ways answer Diane's question as well. Moving, trialing, all of that might add a bit of confusion to the process itself. But if someone was to be staying in a new place, then they will come to terms with the new routine, the new phases, the new activity scheduling over a period of time. So just giving the aging brain, the brain with dementia, a bit longer in terms of, when I say longer, not in terms of minutes or hours, but more in terms of days and weeks, to get that sense of familiarity built in, would be very helpful, even if it was a trial as such. So, so care homes for carers, nursing homes will have nurses, and dementia registered nursing homes will be more specialized in terms of having dementia trained nurses or mental health nurses on board.
That's really helpful to have given us that clarity, Raja. Thank you very much. And maybe, as you say, it might have helped Diane as well. One of the things you touched on there is that it takes time for a person with dementia to get used to the new routine, get used to the new environment, and get used to the new faces. And just, I think, final comments on this is that really applies to the carer as well, doesn't it? This is a huge transition for a carer, not only getting used to the routine of the care home, but also going back home, where perhaps you were living with the person before, and so maybe feeling more isolated or at a loss because you were doing so much the care needs before, and now you're not. And I think that's really important for people to acknowledge as well, isn't it? And gain support for.
Yeah, it does. It is very important, and it does come with a lot of grief. It comes with a lot of guilt. So that is why I think it's very important for these conversations in some ways starting to happen. And I think it might be that we will be that kind of generation where we might be able to talk about it more openly and much in advance of the illness setting itself, for example. And also to try and make sure that carer's assessment is comprehensive in being able to bring out those psychological challenges that carers face, and therefore the local mental health services, the voluntary agencies, even the care home where the loved one might be placed, be in a position to recognize, reassure, and make them feel still involved in the caring role, or feeling still involved in that very important relationship role as well.
Yeah, I think that's it. Getting involved, just because the person's gone into a care home doesn't mean you're not a carer anymore. Absolutely, yeah. You are, because you're supporting the well-being of that person with dementia, and it might be because you transition more back to the relationship of husband and wife, or it may be you also want to be involved in some of the personal care that goes on in the care home. And again, we talk about that in some of the courses. You talked about the psychological needs of a carer, and I was talking about that transition time. And we've had a question here, someone's commenting here that their mum's care home told them that they weren't allowed to visit for the first 2 weeks because it was going to be disruptive, I presume, because it was going to be disruptive for the person with dementia. But that's also, for that carer, that's a huge, overwhelming psychological barrier, isn't it, for them, and something really hard to deal with.
Yeah, absolutely. And I think no care placement should come up with such a blanket rule. You can understand if there was an outbreak of a particular virus that you want everyone to be protected from, prevented from, not just COVID, but sometimes you get in summer months norovirus, which can be quite challenging. So that might be an exception, but it is very important to foster the sense of the relationship still continuing even when someone is in a nursing home or in a care home. And it will only work to the advantage of the care home over a period of time. It makes it easier for the person who's moved into a care home to still feel that they have their loved ones still around them at certain times of the day. It helps the carer to know what to visit and to know that their loved one is in a safe place and they can still visit during particular set hours, and they can still have that quality of time as a family member, as a partner. And I think therefore it is very, very important. I think if people do come across these situations, then they should speak to their mental health service or the social care in that particular locality, who could then be their advocates to try and make sure that they are still able to visit their loved ones.
Thank you. And I think that really brings us to the end. I know we're at 1 o'clock now, but advocacy for you as a carer and advocacy for the person with dementia is really important, because, as you said, everyone's situation is unique and there shouldn't be a blanket cover in terms of for this carer. There needs to be a reasoning why perhaps that recommendation is being made. So much more we could talk about, so much we will pick up, and we will I think definitely pick up another Facebook and look at some of this in more detail. But also, because everybody's situation is unique, there is a range of resources on our website. There are live online sessions if you want to come to those, particularly the 4-week course around supporting somebody or thinking about decisions for you and a person with dementia about a move perhaps to a care home. There are articles on the website, and there's also information about some of those psychological and behavioural changes, and supporting somebody with those changes, and supporting your own well-being and resilience. I think you mentioned resilience a couple of times, didn't you, Dr. Raja? Resilience in family carers is so important. So do have a look at our website. I don't think I've got anything else to say, so I'm just going to hand back to you, Raja. Are there any final comments from yourself?
I think it's important to understand that it's a very challenging and difficult decision to make under the most trying of circumstances. So anything to get people involved to support the carer from any service would be very helpful. And I think that is why I think it's very important for us as a charity to be involved in this. And as Sue said, do call us, do look at all other information that we have, and it would be very helpful. And we'll certainly do another session expanding on some of the more important aspects of move to a care home.
Great. And so that we can expand on it, please carry on putting comments in the chat if you're watching this live, or contact us afterwards so that we can really tailor the next Facebook Live on this topic around what you need. So thank you, everyone. Thanks for joining us. And I'll see you again soon at our next clinic, Raja.
Thanks, Sue. Thanks, everyone.